In 1975 or something like that, the federal government did a study that tried to basically estimate how many people live with MS in the United States using the technology and knowledge we had at the time. It's basically a big word called epidemiological study, the study of diseases and how many people have a disease. And using the tech at the time, that's how they arrived at, roughly around 400,000 based on the information. The challenge we have in this country, as many of the people watching will know, we don't have one single way of counting how many people have a particular disease. So we like to think that the Centers for Disease Control would have an estimate of all the diseases in the United States, that they would have a census. The reality is, though, you'd have to have one big database of all the people in the United States, and well, we don't have that. So what we've done is we said, first we tried to go to the federal government and try to get legislation put through. Well, that didn't work. And so we took the bull by the horns and said, there's got to be a new way. There've got to be better approaches in 2014 when we started this project to figure this out. So we brought some of the world's experts together. And basically what they were able to say is that, while we don't have one big massive database of all the diseases and everybody affected by the disease, the reality is that we actually have lots of different pieces of data. So if you're if you have your employer health insurance, say, as a society, for example, we're with Aetna. Well, Aetna has a database, and United Healthcare has a database, and there's lots of medical records out there. And so this group was able to figure out, where are places we can go to get the information. And so they've put together this really innovative approach to try to get a more accurate number. And so we'll know probably next year if this investment and this new approach will pay off. We're also working with the federal government. So through the 21st Century Cures Act that many people have heard, we advocated for what we call the Neurodata Bill, which basically would provide funding to create a registry for all neurological diseases, not just MS. But we're really proud of the fact that that's now made it through into the House bill and also the Senate bill. And if people want to advocate for it, just go to the hashtag Neurodata, and you'll be able to advocate for passage of this legislation. So that's really where we're at today in terms of trying to get a more accurate number. I know it feels like, the 400K, that really can't be accurate.
Well, I think there's one thing of note is the fact that getting those numbers and being accurate about it costs money.
Right. Yeah.
So then it drives up the whole idea of, is it worth spending the money to get the number?
Right. Question. So with the strategy we're using, because we're using existing data that we're pooling together, it's only going to cost about $1 million to do that, to test it out. If you did a full-blown, what we call classic epidemiological study, we're talking 25, 50, $100 million, and we actually don't yet know fully what that would cost. So it's really, we think this is a great investment because we're using existing resources and really a smart approach.